Hi, Roland. So I'm all done with your cleaning today, and I just wanted to ask you a couple questions.
Okay.
How often do you brush your teeth?
A day?
Yes.
Ooh, like once or sometimes twice if I have time.
Once. Do you know why you're supposed to brush your teeth?
Well, I know it's just to keep them clean.
Okay,
and
so you
bad
have
breath.
microorganisms on your teeth that can grow and multiply, and that's called plaque. So what you want to do is you want to try to brush your teeth twice a day to remove that plaque, because what happens is the plaque will become calculus, and then it's very hard to remove, and then you can get tooth decay and bone loss and things that are much more severe. But if we start taking care of it, then we don't have any of those issues.
If I can remember, plaque is just like in between my teeth. Is it that white thing, yellowish thing?
So plaque is all over your teeth, and what happens is when plaque hardens and it calcifies, it goes in and down in between your teeth. So
Okay.
that's what you want to try to brush off. And remember when I did the disclosing agent with you, I put that color on your teeth,
Yeah,
and everything that turned color, that was all plaque.
Oh wow.
So that's really good to like clean that off, right?
Yes.
So is there any like, what kind of toothbrush do you use? Do you use a hard toothbrush or a soft toothbrush?
Well, I figured to use a hard one just to clean everything out just at once.
Okay, so that's a common misconception as well. You also want to try to use a softer toothbrush so you don't cause damage to your gingival line and your gums, okay? So try to get a soft toothbrush, and I do recommend using a power toothbrush as well, because those are really good at cleaning your teeth, okay? So I'm going to show you a toothbrushing technique that I recommend. It's called the modified Bass.
Okay.
So it's for adults just as yourself, who have the able dexterity and can reach all their teeth and things like that, okay? So I'm going to show you on our Type A Dot model. This is our model, and this is the toothbrush. So first of all, you want to start like kind of at the back, and you want to insert the toothbrush at a 45-degree angle and kind of vibrate it into what we call the sulcus, which is your gums.
Okay.
And do about 3 to 5 strokes and just brush it up. After that, you're going to want to continue all teeth and make sure those bristles get into the sulcus, and just roll it up and roll it up. And do you see how I'm inserting it into the sulcus and then just kind of moving it up to kind
Okay,
of
it's
brush
not
the
that bad.
plaque away, right? Okay, so you want to get, this is all the outside surfaces of your teeth. You want to then get the inside teeth. So this is your lingual surfaces. You want to get these teeth too, because a lot of food and plaque gets stuck in these teeth. And you want to keep doing like this. Once you get to these front teeth, you can turn your brush vertical and really like vibrate it along the surfaces and then sweep it out.
Same procedure.
Same procedure. So
Okay.
you're going to do the same thing for the top as well, so you're going to insert it in the circus 45-degree angle, excuse me, and then this one you're going to roll down. So on the bottom jaw, you rolled it
Roll
up,
up,
and then
okay.
on the top you rolled it down. And you're going to do the same thing, and then once you get to the front, once again you're going to turn it vertical and really get your toothbrush into those margins, okay?
Okay.
Then, once you're done with that, you want to make sure you get all of what we call the occlusal surfaces of your teeth, okay?
It's like the biting surfaces?
The biting surfaces,
okay.
correct, yeah. So you're going to just brush it along the top, and there's little pits and grooves inside all of these teeth that you want to really make sure you get these bristles down into. And remember, just nice, gentle strokes. There's no need to brush hard, okay?
Okay.
And then you want to make sure you do the top as well. And you want to just make sure you get all the surfaces of the teeth. Now, also on top of this, how often do you replace your toothbrush?
When I see the bristles of my toothbrush just coming apart.
Okay, so that's pretty standard.
Okay.
That's a pretty good idea. I would try to replace your toothbrush like every 3 months, because what happens is the bacteria can actually build up on your toothbrush, and then it's basically like washing dishes with a dirty sponge. So
What I do sometimes too is I have a little case, and is it okay if I leave a little case on top of it?
yeah, so just make sure that your case has a hole in it so air can get through. Yeah, so you want to try to get something that air can flow through, because the microorganisms can actually get trapped in that little case and cause damage to your toothbrush and your gums as well.
So we want the toothbrush to be dry.
Dry, yeah.
Okay.
Make sure you use it when it's dry, and make sure there's ventilation going to that toothbrush, okay?
Makes sense.
So did you want to go ahead and try to show me to demonstrate that you know how to do it?
Yeah, definitely.
Cool.
Okay, so you say start at a 45-degree angle, so going this way, right?
Yep.
45.
Perfect.
So a couple 10 strokes, 20
Yeah.
strokes,
Yeah.
maybe 2 or 3 teeth. Is that fine?
Yeah, that's fine.
And then after that, just you say roll up.
Perfect. Yeah.
Okay. And then go all the way around.
Yep.
And you say the front teeth, we go at a vertical angle.
Mm-hmm.
Up, yeah, well, the lingual inside, that's where I have issues. Up, and then you just want to roll out.
Perfect, perfect.
Now, you said the ones on top, same procedure, 45-degree angle.
Mm-hmm.
And then about 10 to 20 strokes.
Yep.
And then roll down.
Roll down. Yep.
So top, roll down, bottom, roll up.
And do you want to brush hard or do you want to brush soft?
Soft.
Good.
And change my toothbrush to a soft toothbrush.
Good. And then just make sure you ventilate your toothbrush so that that bacteria can't build up on your toothbrush, okay?
Thank you so much.
Do you have any other questions?
No, I think that should do it.
Cool.
Thank you.
Okay, have a great day.
You too.